Are you constantly struggling with back pain? In this video, I'm going to show you how muscle imbalances can lead to chronic back pain and what you can do to correct weak and tight muscle imbalances. Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best back pain relief tips so that we can all benefit in our own personal journey to better health. Did you know that back pain is the leading cause of disability worldwide and affects approximately 80% of adults at some point in their lives? While there are several factors that can contribute to back pain, muscle imbalances are often overlooked as a possible cause. Muscle imbalances occur when there is an uneven amount of force between one set of muscles compared to the opposing set. Imagine there are two teams playing tug of war, and one team is much stronger. The strong team is always pulling. The other weaker team is barely putting in any effort because the rope hurts their hands. In a fairly matched game, both teams would pull with the same force. Well, that's sort of what happens with the spine. The front, back, and side muscles have to work fairly evenly so that your spine stays stable when you're doing your everyday activities. So you see, if one set of muscles pulls more than its opposing muscles, it can cause an uneven pull on the spine, which leads to back pain. This can happen due to a variety of reasons, such as poor posture, repetitive movements, lack of physical activity, or even injury. Yes, back pain and sciatica can be caused by a muscle imbalance like tight hip flexors. Sciatica can also cause muscle imbalances, like when you avoid walking on your painful leg and your leg becomes progressively weaker. So if you have an old knee injury that turns into hip pain, that turns into back pain, a muscle imbalance could be the reason. When muscle imbalances occur in the muscles surrounding the spine, it can cause a variety of conditions like herniated discs, sciatica, or spinal stenosis. These conditions can cause constant pain, stiffness, and tightness in the lower back area. You can find it extremely difficult to work and socialize, or even do basic everyday things like putting your shoes on or getting out of the car. How do you even know if you have a muscle imbalance? Here are 6 signs that your muscles may not be working evenly. Number 1, if you do a repetitive type of job or sport all the time. For example, think of a personal support worker who is always bending to help their clients get dressed, get up, and get out of bed. Or someone who plays tennis or golf all year. Or a delivery driver who always climbs in and out of their truck leading with the same leg. Number 2, poor posture. There's a reason why your parents always told you to straighten up when you were sitting or standing. Over time, that comfortable teenage slouch leads to tightness in the front of the chest, short and weak abs and hip flexors, and lengthened and weak back muscles and buttocks. After years, it becomes difficult and almost unnatural to stand straight, which of course leads to a further progression of a hunched forward posture until your spine always feels locked. You might find that anytime you want to straighten up your spine, like for example, getting up in the morning or getting off a low couch, your back tightens up or even spasms. Number 3, definite difference in strength, flexibility, or balance on one side versus the other side of your body. You might find that you can stand on one leg easily, but lose balance if you stand on the other leg. Or you may find that your non-dominant arm gets tired easily while doing simple household tasks. Or you can scratch your back with one arm, but not with the other. Sometimes you can see changes to the body, like a curvature in your spine, known as scoliosis, or having one leg longer than the other. Number 4, your pain came on very gradually. You can't seem to figure out how it first started. When you can't connect your pain to a specific incident or injury, often it's from everyday activities that you've done the same way for years. Think about how often you lean on the same elbow on your chair and in the car. How many years have you slept on the same side? How often do you cross the same right leg over the left? Number 5, your shoes and clothes fit differently from one side of the body to the other. A classic example is your shoes. Do you find that one side of your shoe always gets worn out before the other? Or maybe your purse doesn't stay on your right shoulder, only on your left. Or perhaps your pants need to be hemmed at different lengths. And finally, number 6, you sit for most of the day. It's impossible to maintain perfect sitting posture all day long. In fact, it's not even recommended. What's more important is to change positions frequently throughout the day. How frequently? A good rule of thumb is to get up after 30 minutes of sitting. That could mean standing for 5 minutes if you're at the office, or walking around if you've been watching TV, or getting out of the car for stretch breaks when you're on a road trip. When you sit for a long time, your large muscle groups in the legs weaken, your abs and back lose strength, and your discs get compacted in a bad position. These changes happen so gradually that you won't really notice until you've lost a significant amount of strength and your back and hips feel stiff and painful all the time. There are a number of different muscle imbalance patterns that can occur. In this video, we'll go through the 2 most common patterns, the upper cross syndrome and the lower cross syndrome. The upper cross syndrome is typically seen in people who have sitting jobs like desk workers, drivers, and people who are on their phone all the time. Their heads are forwards, chin stuck out, a hunched upper back, and the shoulders that are rounded forwards. The upper trap muscles, pecs, and neck muscles are tight, and the rhomboids, lower trap muscles, and deep neck flexors are weak. Essentially, the front neck and chest muscles are tight, and the mid-back muscles are weak. Good exercises to start with are pec stretches in the door frame, chin tucks and nods to strengthen those neck muscles, and face down W's to strengthen those weak middle and lower traps muscles. The lower cross syndrome is slightly more complicated. There are 2 main types. Type A, forwards pelvic tilt, and type B, backwards pelvic tilt. Let's first imagine that your pelvis is like a giant bowl of water. The best position for the spine is when the bowl is perfectly level. A lower cross syndrome with a forward pelvic tilt is when your pelvis tips forwards. So our giant bowl is tipped so that the water is spilling out down the front of your legs. A lower cross syndrome with a backward pelvic tilt is when the bowl of water is tipped back, where water is spilling down the back of your legs. To make things even more complicated, we also have cases where the bowl can tip sideways or be rotated to the one side. Because the pelvis is actually made up of 2 identical halves, we can also imagine that there are 2 bowls side by side. Sometimes one side is tipped forwards and the other side is tipped backwards, but that's for another video. Let's go back to the anterior pelvis, or bowl tip forwards. We can usually spot this when someone has a large arch in the lower back and slightly bent hips and knees. They tend to take shallow breaths and may have bowel and bladder issues because of inadequate pelvic floor control. Here we have tight low back and hip muscles and weak stomach and buttocks muscles. If that's you, some good exercises to start with are bridges with a resistance band around your knees to strengthen your glutes and stretch out your hip flexors, a half kneeling lunge stretch for tight hip flexors and quads, and the child's pose to stretch out those tight lower back muscles. The most important thing when it comes to form is that you keep your pelvis bowl level and avoid hyperextending the back. Now with the posterior pelvis, the bowl is tipping backwards. People with this muscle imbalance pattern tend to have a hunched upper back, straighter lower back, and hyperextended knees. Here we have weak front hip and knee muscles and tight buttock and hamstring muscles. A posterior tilted pelvis is less common than the anterior tilt. If this sounds like you, some key muscles to correct your muscular imbalances are the hamstring stretch, the figure 4 stretch for tight glutes, standing high knees to strengthen the hip flexors, and squats to strengthen the quads muscles. 2 good yoga poses for tight hamstrings and glutes are the downward dog and pigeon pose. Once again, the most important thing when it comes to keeping proper form is to have a pelvic bowl that is essentially perpendicular to the spine. If you really want to learn more, check out the affiliate link in the video description, My Back Pain Coach, for a comprehensive exercise guide on simple, targeted exercises to fix your back for good. No special equipment is needed. If you're really struggling with a forward tip pelvis, check out the other affiliate link in the description, Unlock Your Hip Flexors program, that also comes with a hip stretching tool. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.